Good afternoon to one and all. I welcome you all to the fifth day of TATVAPRABODHINI, a ninth scientific session, a national level webinar series conducted by JMC Mysuru on Ayurveda for COVID pandemics. So now I am here to introduce our today's guest speaker, Dr. Shilpa M. Sutagatti. Ma'am has completed UG from Inchel College and Hospital with distinction in all the 3 years and awarded with gold medal in the year 2014 and post-graduation from GMC Bangalore and secured 4th rank at state level. Ma'am secured first rank in PG entrance exam in the year 2014. Madam has written articles on importance of sattva in Panchakarma published in Ayurpub online journal. Madam has presented scientific paper on neuromyelitis optica, Vaitarna Basti in the management of PCOS, Shirodhara in the management of psychological symptoms. Madam has attended many conferences, workshops which were held at Bangalore and Ayurveda Pharma Coimbatore. Madam has a special interest and participated in culturals and sports activities during her graduation and post-graduation. Presently, Madam is working as an assistant professor, Department of Panchakarma at GMC Mysore. Ma'am is going to deal with a topic on preventive management of physico-psychological complications of COVID-19 through Panchakarma. With this short introduction, I welcome you, ma'am, for the today's session. Over to you, ma'am.
The Department of Panchakarma, GMC Mysuru. So today I'm going to present a topic that is an early management of physio-psychological COVID-19 complications through Panchakarma. So comes to the COVID-19. COVID-19 is considered as a fatal disease caused by novel coronavirus, and the causative agent attacks on the respiratory system, which causes breakdown of part of body's immunity system, and in severe cases, it also affects the immune system, which produces the signs and symptoms which are making it vulnerable to unusual life-threatening illness. So what are the COVID complications and how it is going to impact? The first, the COVID complications are common in the persons who are aged or having comorbidity. So about 1 in 6 will have complications. It may be caused by a condition known as cytokine release syndrome or cytokine storm, when the infection triggers immune system to flood bloodstream with inflammatory proteins called cytokines, which can kill tissue and damage organs, including lungs, heart, and kidneys. So, what are the acute complications which we are seeing during the COVID? So, that are acute respiratory failure, pneumonia, acute respiratory distress syndrome, acute liver injury, acute cardiac injury, secondary infections, and acute kidney injury, disseminated intravascular coagulation, and chronic fatigue. So, these are some of the complications which we are seeing during the COVID. According to the latest update, EpiWin, so it is by WHO, the lingering symptoms reported by participants of a multi-state phone study in the USA says symptoms which may persist even after the recovery are fatigue, cough, congestion, shortness of breath, loss of taste or smell, headache, body ache, diarrhea, nausea, chest or abdominal pain, and confusion. So these are some of the common symptoms which they have got in the survey. So, in a telephone survey of symptomatic adults who had a positive outpatient test result for SARS-CoV-2, that is COVID-19, 35% had not returned to their usual state of health when interviewed 2 to 3 weeks after testing. So, among those, 18 to 34 years are in good health. 20%, that is 1 in 5, reported that some symptoms were prolonged. So, even after the recovery and discharge from the hospital, they were having these symptoms. Risk factors for persistence of symptoms are high blood pressure, obesity, mental health, and other symptomatic illness. So, the person who are already suffering from one or the other systemic illness, they will be having risk factor for the complications. Next, several COVID-19 recovered patients returning to the doctors with conditions including breathlessness, cardiac, lung, and other complications. According to a newly published study from Italy, many patients with even milder forms of COVID-19 have persistent symptoms of fatigue and difficulty in breathing for up to 60 days of post-infection. Furthermore, researchers of this Italian study report that almost 43% of recovered patients have worsened quality of life, and almost 87% recovered patients have at least one persistent symptom even after 2 months of their recovery from the disease. So this shows that even after the recovery from COVID-19, there is a long-term impact of COVID-19, and it is going to affect the health of the person. So here the studies indicate that symptoms last longer for over 8 to 10 weeks. So it is at least 8 to 10 weeks. So these are just the persistent symptoms. These are not the complications. So COVID-19, so it is not only having the effect on respiratory system that we have already known till today's date. So it is having a systematic involvement. These are the different systems which it may affect. Next, the post-COVID effects, the organ damage. So after the recovery from the COVID, what are the organ damage which may occur due to the COVID-19? So it is the heart, lungs, brain, mood and fatigue. So here, the imaging test after months recovery shows long-lasting damage to heart muscle. Small clots and even the large clots cause the heart attack and stroke. So this increases the risk of heart failure and other heart complications. Regarding the lungs, the pneumonia, so which is a very commonest complication we are seeing during the suffering from COVID-19, pneumonia, so which in further or the in future can cause the long-standing damage to tiny air sacs and which is going to result in scar. So there will be a lung scar and followed by lung fibrosis. Next, the brain. So brain, yet the complications on the brain are not known, but there are rare cases of GB syndrome, seizures, and strokes. So in future, we may get the more cases regarding this. The next one is cognitive impairment, so memory and the the other concentration problems will be there. Related to mood and fatigue, so post-traumatic stress syndrome, which is the commonest complication we are seeing, especially in the cases who are discharged from the ICU. So because of that, they are suffering from this or anxiety or chronic fatigue syndrome. Next is on the musculoskeletal. So pain in joint and muscles. So these are common symptoms we can see. Fatigue and related to kidney and liver. So there are very rare complications or symptoms we are seeing, but still there are some biochemical changes in blood related to the kidney and liver. So there is high levels of protein in the urine and abnormal blood work and effect on liver. There is altered liver function test, which is conducted after the COVID recovery. So till there is need of the research. So how much it is going to affect the organs. So coming to the Panchakarma. So where we are going to opt the Panchakarma and how it is going to help in the post-COVID cases. So before going to that, let us understand the Ayurvedic concept regarding the COVID-19. So there are different concepts here. So some we can correlate it with the Jwara is there, Vata Kapha Jwara is there, Kasa is there, Shwasa is there. So the based on the different lakshanas or group of lakshanas we are seeing in the patients, we usually correlate with it. But it's better to go with the Srotas concept. So based on the different lakshanas, so it may affect the pranavaha, annavaha, udakavaha, rasavaha, raktavaha, mamsavaha, and mutravaha srotas mainly. So till date, it is mainly, but of course, rarely it may affect the other srotas also in the long run. So Ayurveda has greatly appreciated for prevention of any disease. So rather than treatment, it concentrates on the prevention first. So what are the strategies for treating the disorder or preventing the disorder is Nidana Parivarjana, Apakarshana Chikitsa, and Pragriti Vighata. So Nidana Parivarjana, so it avoidance. So we are using masks and using sanitizers. We are keeping distance, avoiding the crowded public. So everything we are doing is coming under the Nidana Parivarjana and Apakarshana Chikitsa. So what we are doing is Panchakarma is one of the Apakarshana Chikitsa here. Prakriti Vighata, so here the treatment aspect and the Rasayana Chikitsa, Sadhut Palana, everything will come under the Prakriti Vighata Chikitsa. So the communicable disease in Ayurvedic literature is, comes under Janpododvamsa, so which is due to the impairment of Vayu, Udaka, Deshakala, so that there are many sessions over this already has been over, so everyone knows about this. So Adharma, Samsargaja and Upsargaja, Vyadhi, so these all come under the communicable diseases. So the treatment or the prevention told for this can be taken here. Okay. So the next is Ayurveda's insight of preventive care based on the concept Dinacharya, Rutucharya, Panchakarma, Rasayana. So these Dinacharya, Rutucharya, Panchakarma, Rasayana are for prevention also of COVID, and also in the post-COVID cases, you have to follow the Dinacharya, Rutucharya, you have to follow Panchakarma to avoid the further complication or any organ damage that has already happened. So for that also, you are preventing the further complications and Rasayana Chikitsa. So here we'll dealing with the Panchakarma. Seeing the systemic effect of novel coronavirus, there is a need of adopting Panchakarma modalities, preventing the long-term effects which may arise. So we are not yet sure that only these are the complications. So in further years or in months, we can get to know many trials, so where we can see other complications also on other systems. So it's better to opt for the Panchakarma or Shodhana procedures to avoid the complications which occurs generally after the initial recovery, and to treat them in the early stage. So in post-COVID, how we are going to take Panchakarma? So first you have to divide the different patients after the post-COVID, that is without any persistent symptoms. Uh, they are the group 1 with persistent symptoms. So group 2, post-COVID complications. So already there's a starting of the any one of the one or the other complications, then it will be group 3. So in group 1 is to prevent complications. So there are no persistent symptoms, but you have to avoid any complications. And in case of group 2, it is to treat the remnant symptoms and to prevent complications. In post-COVID complication, that is group 3, it is to treat complication in mild stage or the early stage. So it's to maintain the proper function and to avoid the further damage to the organs. So Shodhana. Coming to the Shodhana, so how it is going to help? So before adopting the Panchkarma modalities, how it is going to help in the post-COVID cases? So to prevent the post-COVID effects, Vamana procedure in cases of Kapha Pradhana. So first you have to go to the indications of Vamana. Simply you can't select Vamana and Virechana. So first the Prakriti, the Vyadhi conditions and the Lakshanas, the Srotas, everything you have to go through, and once it is fit for Vamana, then only you can select for Vamana. So it is applicable for Virechana also, where the Pitta Pradhana Lakshanas are there and who are fit for Virechana. For them, you can select the Shodhana. So even after the recovery from COVID-19, it is needed to prevent any systemic complication and to treat them in the early stage. For this reason, we are going to select Shodhana. So how it is going to help? It does the Shroto Shodhana, eliminates the Prakupita doshas from the Sharira. So even though the initially the patient has been recovered completely, they have been COVID-19 negative, but still there is the dosha remnant in the Sharira, which is going to affect one or the other day. So it's better to go for the Shodhana, which improves the Agni and so and provides Bala. So after once the patient has been suffered from COVID-19, we can see there is loss of strength. They don't get proper sleep, and these all problems will be there. This not it is due to the remnant doshas and the suffering because of the COVID-19. So here it helps in maintaining a healthy life. So that's why it is better to go for the Shodhana. Also to improve the quality of life, and if we are planning for Rasayana therapy, after the post-COVID. So as a Purva Karma also, Shodhana is must. Next, coming to the Basti. So Basti is considered as the Chikitsa. So here, if you want to give Rasayana Basti, Balya Basti, and based on different systemic involvement. So if any complications in early stage are there, any persistent symptom is there, for the Balya purpose, in any form you can give based on the different combination of the drugs, you can go for the Basti. So here, next, where the post-COVID cases are not fit. So if the patients are not fit, or the cases, the person who are already suffered from COVID-19, if they are not fit for Shodhana, it's better to administer Shodhana Basti. So Basti, so any karma, so it may be Lekhana karma, it may be Shodhana karma, it may be Balle karma, Rasayana karma. So based on different karma or action which is needed in the person, you can do the combination of the medicines and you can give the Basti. Next is Nasya. So in Jatru Urdhva Vikara, so any persistent symptoms, which is Jatru like Shiro Gaurata is there, Shiro Shula is there. Okay, in such cases, you can go with the Nasya. So Pratimarsha Nasya can be self-administrable, so you can just guide the patient properly and they can take the Pratimarsha Nasya at home. Shiro Virachan Nasya can also be adopted, helps in eliminating the remnant doshas. So specifically, if the symptoms are only seen in the Jatru Urdhva, then you can go with the Shiro Virachana type of Nasya. Murdhini Taila, so it is a very important modality when the global problem we are dealing here, and there is a lot of effect by the social this also. So the patient who is suffering from COVID-19 is being mentally suffering also, and there is a long-term quarantine from their family, and there is a different behavior they get from the other people also, so it causes depression, anxiety, and other stress-related problems. So it is a must and must to go for Mudhini Tailas. So here, Shirobasti, Shiropichu, Shirodhara, and Shirobhanga. So Mudhini Taila, how it is going to help in the COVID cases, or how it is going to help in the anxiety, depression, and other psychological problems. So it is based on the its probable mode of action on HPA axis and effect on marma. Okay, so there, you know how in the shiras there are, it is having many marmas. So effect on those marmas, vascular effect. Okay, so by the circulation effect and the nervine effect and effect on the shat chakra. So the shat chakras are having effect on the all the metabolism of our body, and if it is affected or it is going to be maintained by the Murti Mitala, then it will help to relieve the condition. So has in Murdini Tela, it induces a relaxed state of awareness, which results in a dynamic psychosomatic balance. A total feeling of wellness, mental clarity, and compression is experienced in this process. And it also restores the equilibrium of Sharira and Manasika doshas through the psychosomatic axis, which in turn facilitates Mano Prasannata or tranquility of mind, a positive sign of healthy state of body. So in Ayurveda, we not only gives importance to the Sharira Chikitsa, it is always a body and the mind and the soul in combination only makes the Purusha. So if you are doing the Chikitsa, you have to take care of all the factors. So here also we have to take care of the mental status of the person. Prevention of the post-COVID complications in group 1. So where there is no persistent symptoms. So how we are going to deal with it. So Vamana. Vamana with Madana Phala. And if the persons are Sukumara, then it's better to go with Vatsaka that can be administered. So if there are no persistent symptoms and the Bala is moderate, then it is better to go with the classical Vamana and Virechana. So it is followed by Deepanapachana, Snehapana, then 1 day gap for Vamana and followed by Vamana and Samsarjana Krama. And in case of Virechana, with Trivrita, or if Sukumara persons are there, you can go with the Chaturangula that can be administered. So here 3 days gap, Snehapana, 3 days gap for Virechana. Then after Virechana, Samsarjana Krama according to the different Shuddhis. Coming to the Basti, so Balle Basti, Rasayana Basti. So most commonly used Basti you can use here is Mustadiyapana Basti. So it is having all the effects on all the systems and it gives strength also and Rasayana effect also. Next is Pratimarshanasya. So Pratimarshanasya, it's not mandatory to come to the hospital or the presence of physician. Once you guide the person properly, it can be administered at home also. So the different medications that can be used are Anutaila, Kshirabala Taila, Balamula, Vidari Kandadi, Gana mixed with Grita and Sandava. So processed Grita should be used. Vidari Gandha and Yashti Madhu Siddhakrita mixed with Sandava that can be used. Proponarakadi, Yashti Madhu, Pippali, Brahati, Balamula Kalka mixed with Siddha Dugdha you can use. So it is freshly prepared. You have to prepare it and every day you have to prepare and you have to administer it. The above Nasya could be administered as Pratimarsha Nasya in daily routine. So it is for Marsha and Pratimarsha. Both you can use, but in Marsha, the presence of physician should be there, okay, and it should be done properly based on the Nasya procedure. So Kavala, Gandusha, that is Narikela Taila, Haridrakata, and Tankanajala. So it is done, it should be done routinely till we get a proper vaccination or the treatment, till we don't know when it is going to end. Till then, it, as a daily routine, we have to follow it as a dinacharya. So Narikela Taila, which is available very easily, Haridrakata, and Tankanajala that can be used. Shiro Abhyanga with Narayana Tela, Kshirabala Tela, and if the availability is not there, you can go with the Narikela Taila or Tila Taila also. Okay, for Shiro Abhyanga. Sarvanga Abhyanga, here Mahanarayana Taila and Bala Taila or any Vatahara Taila or Narikela Taila can be used for Sarvanga Abhyanga. So these all procedures are done in the post-COVID cases where there are no persistent symptoms. So whichever taila is available at home, so it may be a simple narikela taila also, Sarvanga Abhyanga will be beneficial. Svedana, so Nadi Svedana in form of steam inhalation that can be done. And Ushna Jala Snana. So it is always beneficial to have Ushna Jala Snana. So these are some of the panchkarma that can be routinely adopted in post-COVID cases. And one more thing, in post-COVID cases, there are cases where even after the recovery from COVID-19, they have been again after 1 month or 1.5 months, they have again suffered from the COVID-19 symptoms. So again, they have got positive and they had been admitted in the hospital. So such cases are happening now. So it's better to take care even after once you have suffered. So we are not sure. So how the coronavirus is going to affect the system and what is the strength of this virus? Still, research has to be done. Next, coming to the prevention of the post-COVID complications in group 2. So that is with persistent symptoms. So here, what are the symptoms are there? You have to go through it. And based on the different doshik lakshanas, you are going to go for the different procedures. So vamana, in case of loss of appetite, indigestion, if it is there, and the bala. So the rogi bala is very important when you are going for shodhana and indication also. So kapha pradhanata is there. So of course, when there is law aruchi is there, avipaka and hrillasa, such symptoms are there, then it shows the kapha pradhanata. And if the rogi bala is also proper, then you can go with the vamana. So here it is classical vamana. So next coming to the sadhyo vamana. So if it is sasa, shwasa, so difficulty in breathing is there and the patient is stable. So if the patient is not stable, of course you should never go with the shodhana. The vitals should be stable, then you can go with the Sadyavamana. So here Sadyavamana also you can use the Pipli Churna and Madanaphala along with Sandava and Madhu. Virechana, so Mrudu Samsrana with Aragvada in old age patients. So old age patients we can't go with the classical type of Virechana. So daily quantity of Aragvada Churna or Aragvada Kashaya can be given for the Samsrana effect and Nitya Virechana with Gandharva Hastadi Taila. So in the old age cases where they are hypertensive, so comorbidity exists, and suffering from Malabaddhata, Admana, Atupa, if such lakshanas are there, then you can go with the Nitya Virechana with Gandharva Hastadi Taila or Yaranda Taila with Shiva. Basti. So Yapana Basti are to be used, which provide a sign effect and Adbalya in case of chronic fatigue, generalized body ache, joint pain, and sleep disturbance. So here Mustadi Apanabasti can be used or Baladi Hiruhabasti can be used. In case of Nasya, so Pratimarsha Nasya should be followed in all post-COVID-19 cases immediately after initial recovery. So it is a daily routine. But Marsha Nasya, where it is, so different yogas you have to select based on the different lakshanas. Marsha Nasya can be given in headache, that is Shiroshula, loss of smell sensation, and sleep deprivation. So Shiro Virechana type of Nasya will be beneficial. Pradhamanasya in symptoms of running nose, nasal block, drowsiness, and chronic fatigue. So, if such symptoms are there, then you can go with the Pradhamana, that is Tikshna type of Churnanasya can be used. Murtini Taila. So, people with sleep deprivation, sleep disturbance, headache, loss of taste and smell sensation, burning sensation in eyes, hypertension can be given Shirogasti. So, but the patient should be stable and able to sit for the procedure. That is very important here. Shirodhara in case of excessive sleep disturbance, anxiety, or so more of psychological conditions. If you are seeing in the person, then it's better to go with Shirodhara where the vata or the neurological conditions, if they are present, then it is better to go with the shirobas. So coming to the post-COVID complications, that is group 3. So respiratory system. So several reports suggest that after recovering from the severe COVID-19, they have experienced lung damage, including partial or complete lung scarring, that is, lung fibrosis, that results in severe functional limitations. So, gradually, the scar tissue can destroy the normal lung and make it difficult for the oxygen to get into the blood. So, low oxygen levels can cause shortness of breath, particularly during physical exertion. So, this impaired lung function from SARS-CoV-2 infection can negatively affect other organs like heart, kidneys, and brain with significant health impacts that may last after getting over the infection. So these are the symptoms. Once the lung scar has been started or lung fibrosis, it affects the other system also. So if there is a earlier symptoms, if the complication already had been started after the COVID-19 recovery, so what are the intervention that can be done is so Sthanika Abhyanga Lavanakta Taila, Swedana, that is Nadi, Prastara, Sankara Sweda, Sadyovamana, that can be done with Madanapala, Pippali, Sandava, Madhuvikta. So only in case of Kapha Pradhana, you are going for Vamana. And all these procedures, it should be done based on the assessment of the Rogi Bala, that Roga Bala, and Doshika Avastha. It's not like the person will need some emergency treatment and you can't go with these treatments. So till the alternative treatment will be provided to the patient, you can just subside the lakshanas. For this reason, you can use it. Mridu Virechana. So this can be given to the patient. So that is Vata Shleshmahara, Vata Anulomana, Avipatikara Churna, Haritaki Churna with the Ushna Jala. So why Mridu Virechana is important here is for two purposes. So one is Vatanulomana and for the Vata Shleshmahara also. So if the drugs having the Vata Shleshmahara quality, if you are giving Virechana with this, that is doing the both actions. So these are the two drugs which you can use for the Mridu Virechana. It's coming to the cardiovascular system. So, according to the small study published in the journal JAMA Cardiology, some people who recover from COVID-19 may have lingering heart damage and inflammation of the heart muscles or myocarditis months after their initial infection. So, the complication is it's not like only in 1 week or 2 week you are going to observe it. Even after 1 or 2 months, you can observe these symptoms. So, severe systemic inflammatory conditions may aggravate irregular heartbeat in some individuals, and there will be acute inflammation, which is caused by the virus infection, can worsen both cardiac and kidney functions. So, there is also hematological complication. The most common hematologic complications of COVID-19 are lymphonia, neutropenia, and thrombocytopenia. Some other hematological findings include decrease in hemoglobin, coagulopathy, disseminated intravascular coagulation, and which induces a hypercoagulable state in the body, leukocytosis, increase in C-reactive protein, increase in calcitonin, increase in ferritin, LDH, or other complications of the disease. The main feature of COVID-19 coagulopathy is thrombosis. So these are the cardiac and hematological complications seen in the post-COVID. So what are the intervention? So what are the intervention we are discussing here? It is in the only in the earlier stage where the patient does not need hospitalization. There you can go with the Panchakarma intervention. So Abhyantara Snehana, that is Jivaniya Gana Siddhakrita, Kakulyadi Gana Siddhakrita, that can be given for the Shamananga Snehana. Mrudu Virechana is given with Aragvada Kashaya or Avaleha Tripla Kvata. So in case of Kafaja, you can go with the Tripla Kvata. Ruksha Snehayukta Virechana. So Trivutta Churna with Kshira, Avipatikara Churna, Yaranda Taila with Kshira. So here the Chikitsa has been taken from the Hridroga Chikitsa and Vatarakta Chikitsa. So by taking this, there will be, you can maintain the organ damage to the further complications and to improve the health of the person. So Basti, Dashamula Niruha Basti and Kshira Basti. So based on the Ama Nirama Avastha and the Doshika Avastha, you are going to select whether you will go with the plain Niruhabasti or Kshirabasti. Manjishtadi Niruhabasti or Kshirabasti can be adopted. Madhu Yashtadi Taila in Asthapana and for Anvasana. So Madhu Yashtadi Taila can be used in both Asthapana also and Anvasana purpose also. Mustadi and Hapushadi Yapanavasti. So these are having Rasayana and Balya and are having effect on all the systems, so that as a balya purpose you can use it. Seka, so if there is any deep venous thrombosis, is there superficial venous thrombosis, in such condition you can use Seka. So Dashamula Kashaya Seka, so it is Thanika Seka we are talking here. Dashamula Taila Dhara and Pinda Taila Dhara can be done. Shirodhara, so it is very important to go with the Shirodhara. So in any complication, whether it is cardiac or related to the kidney or related to the musculoskeletal system, Shirodhara is beneficial as it is having uh, effect on the all endocrine glands by controlling the hypothalamus and the pituitary gland. So it is must to opt for the Shirodhara in all the systemic complications. So Tailadhara, Narayana Taila can be used here. Abhyanga, so Abhyanga can be done. So here it is something stress relieving. So we can go with Bala Ashwagandha Taila, which helps in the micro circulation and reduces the peripheral resistance also. Coming to the psychological deficits, so additionally, along with other systemic illness, so people requiring intensive care, so who are discharged from the ICU, are at an increased risk from the mental health issues like post-traumatic stress disease, anxiety, and depression. So earlier reports from China and Europe revealed that some patients recovering from COVID-19 experienced anxiety and depression. In addition to mood disorders, several recovered patients may have neuropsychological symptoms also, including dizziness, numb limbs, long-term loss of smell and taste, cognitive changes such as difficulty with attention and memory and brain fog. So these are some of the common symptoms which we can see. So especially the person who are hospitalized are suffering more from the psychological symptoms other than the mild cases who are at home. So at home only they are taking the treatment. For them, they are not so much suffering from these symptoms, but for hospitalized cases, yes. So Panchakarma intervention in psychological is Snehana, that is Shamananga Snehana here, Panchagavigrita and Brahmigrita. And for Shodhana purpose also, if the patient is fit for Vamana and Virechana, then also the Snehapana can be done with Panchagavigrita and Brahmigrita. So here Mridu Shodhana, that is Avipatikara Churna, Tripla Churna. So Vata Pradhana Avrita Marga. That means, so if the Avarna is there to the Vata dosha, then you will go with the Mridu Shodhana. If Kapha Pradhanata is there, then Vamana, and Pitta Pradhanata Virechana. So this is the classical type of Vamana Virechana. Basti, Mustadi Yapana Basti, and Baladi Niruha Basti can be administered. So, which is having the Rasayana Medhya effect also. So, Mustadi Yapana Basti is having Medhya effect. And if you are using Kalka Dravya as Yashti Madhu and other Medhya Dravyas also as a Kalka Dravya, so it will be more beneficial. Shiro Virechana, so Shiri Shadi Nasya, it can be used in Kapha Pradhana conditions. Nasya, Yashtimadu Taila Nasya and Brahmi Taila Nasya. It can be used for Pratimarsha Nasya also and for Navana type of Nasya. In Abhyanga, Kshirabala Taila and Mahanarayana Taila. So along with the Shirodhara, if we are doing these all procedure, it is helpful. So coming to the main procedure, so in combating the psychological condition, Shirodhara plays a major role. So it is Tailadhara with Bala Taila, Bringraj Taila, Jatamamsi Taila, Takradhara, that is Amlaki Yashti Madhu Siddha Takra, or you can process it with Amlaki Musta Siddha Takra also, you can use it here. Bala Siddha Takra and Kshiradhara with Bala Siddha Kshira, Dashamula Siddha Kshira. So it is why we are using particular medicines, because the Shirodhara is not only having the procedural effect, it is also the drug effect. So if the lipid media is used here, so like Kshira we are using, Takra we are, Taila we are using here after the Shiro Abhyanga. So it is, there is quantity of absorption, so percentage of procedural effect also. So neurological complications. So there is little information available on the possible adverse effect on the neurological system. So very rare symptoms we are seeing, but we don't know. So it's better to go for the prevention now only. So in a retrospective study of some neurological symptoms accounting for 36.4% of all confirmed COVID-19 patients. Patients with severe COVID-19 were more likely to develop neurological symptoms such as acute cerebrovascular disease, impaired consciousness, and skeletal muscle injury. So these are the common symptoms which are seen. So the Panchkarma intervention here is the Mridu Virechana. So wherever the Marga Avarna is seen, you can go with the Virechana. It is Shutushodhana and Vatanulomana. So Gandharva Stadi Yaranda Taila with Shira is the commonly used Mridu Virechana Davya, which is having Snehika Guna also. Snehika Virechana and Snehana, that is Bahya Snehana, that is Abhyanga. Svedana, Nadi Sveda, Patrapinda Sveda, Shashtika Shalipinda Sveda, Mashapinda Sveda, and Ushma Sveda. So, Svedana here, regarding the Patrapinda, Shashtika Shali, Mashapinda Sveda, they are more helpful when you are seeing musculoskeletal symptoms are observed. In such cases, you can go with this because they are Balya, even though they are Svedana, they are Vatahara and Balya. Basti, so in case of Durbala and Avirechya, so in the persons who are Avirechya and Durbala, for them Basti is the best line of treatment. Coming to the Nasya, Kshira Bala Taila, Karpas Ityadi Taila, Dhanvantara Taila. So in Basti, there are many options. So Vatahara Bastis are there, Yaranda Muladi Niruva Basti is there, Dashamuladi Niruva Basti, and Kshira Basti. So based on the dosha avasthas and stage of the disease, we are going to select the different bastis or shodhana. Next, coming to kidney. So, some people suffering from severe cases of COVID-19, they are showing signs of kidney damage, even those who had no underlying kidney problems. So, before suffering from COVID-19, they were not suffering from any kidney problems, but still they have the kidney damage. So, that has been reported in China and New York. So, it has been studied there. Signs of kidney problems in patients with COVID-19, which includes high levels of protein in urine and abnormal blood work. So the levels of protein in the urine, especially the blood urea and creatinine, that was in the high level. So yet to the research has to be done in this field. And in case of uh, the coexisting chronic conditions like high blood pressure and diabetes, it is the increase to the risk of the kidney disease. The impact of COVID-19 on the kidneys appears to be multifactorial. The prefactors from comorbidities of COVID-19, such as cardiovascular disease, hypertension, chronic kidney disease, and diabetes, can be seen as the contributors for the development of kidney impairment and acute kidney injury. And the additional conditions are specially responsible for glomerular damages, which are occurring in COVID-19 pathogenesis. So already if there is comorbidities, they are the risk factor for the kidney impairment or acute kidney injury. So the intervention, it is Snehana, Abhyantara Snehanam, Bahya Snehanam. So it is Anutaila Nasyam. So in this form, you are going to give the Snehana. Swedana, that is Shashtika Shali Pinda Sweda, Pata Sweda, Ushna, Shika Avagaha Sweda, and Sarvanga Sweda that can be adopted. Niruha Basti, Punarnavashtaka, Punarnavashta, Kashaya Basti, Varunadi Kashaya Basti, Aragvadadi Kashaya Basti. So, in Basti, these are having effect on the Mutravah Srotas that can be adopted here. Anvasana Basti, Nirgundi Tailam and Dashamula Tailam, and Virechana, if it is with the Pradhana, then you can go with the Virechana. Liver, a high prevalence of altered liver function tests were noticed in Italian patients with COVID-19, and this was associated with worse outcomes when developing severe acute respiratory distress syndrome. So, where the liver injury was seen in the cases who are suffering from the acute respiratory distress syndrome, and the changes in liver biochemistry might result from the systemic inflammatory response, pneumonia-induced hypoxemia, or in drug-induced hepatic injury. So, not only due to the COVID virus effect, because of the medicines. So, when the person is hospitalized in ICU, or even if he is suffering moderately, there are too many medications are given to the patient. Because of the drug induced, there will be hepatic injury. So already the rogi bala is avara, and in such, if the drugs, different strong drugs or medicines are used here, it will cause the hepatic injury. So there has not been many cases of liver injury, but in future we can see how much it is going to affect the liver here. So the intervention which can be done. So if already there are some early symptoms which you are seeing in the person, then go with the Mridu Virechana, Pikta Rasa Pradhana. So you can go with the Katuki or Avipatikara Churna also. So it is doing the Vedana. Next, Avapedanasya, that is Jimutaka, Karkutaka Mula, Churna for the Pradhamananasya. So in early stages. But of course, once the liver injury goes to the um, in the further complications, it is very difficult to treat with the panchakarma also. So it's better to prevent such things. So in the person in whom there are no symptoms, in those the complications can be prevented by using the shodhana and the other panchakarma modalities. So the conclusion here is an early diagnosis and detection of the complication is most necessarily in managing complications. So once the complication has started, if you are detecting it earlier and treating it with the Ayurvedic treatment, so here Panchakarma procedures, Shodhana and Snehapana, Svedana, Basti. So Basti plays a major role here. So it is easier, but if it develops to the further complications, it will be very difficult. Next, the adoption of Panchakarma in early stage makes it an ideal treatment modality in preventing. So prevention has to be stressed more when compared to the treatment. Okay. So treating post-COVID complications, hence providing the healthy life. Thank you. So here I'll just wind up my presentation. I want uh, I want to thank all of you. So I especially want to thank our principal sir, Dr. Hegde sir, for giving me the opportunity to present this topic. I want to thank my HOD, Dr. Varsha Kulkarni ma'am, who has selected this topic and given this opportunity to give my opinion regarding this. I want to thank the Panchakarma PG scholars who have helped me with these presentation, and all the organizing committee, scientific committee members. I want to thank one and all. Thank you.
Thank you, ma'am, for the wonderful presentation. It was really enlightening regarding Panchakarma and sharing the knowledge regarding preventive management of complications of COVID-19 through Panchakarma. So, thank you, ma'am. Thank you. So, our next presenter for the ninth scientific session is Dr. Mohan Kumari, KM. Ma'am, I take this great privilege to introduce you, ma'am. Madam has pursued undergraduate degree from Ashwini Ayurveda Medical College, Davangere, and post-graduation from GMC Bangalore. Ma'am has 16 years of teaching experience and also published research articles in Ayush journals. Presently, Madam is working as an associate professor and HOD Department of Shalakya Tantra at GMC Mysore. Ma'am is going to present on the topic utility of Kriya Kalpa as a preventive measure in the present scenario of COVID-19 pandemics. With this brief introduction, I welcome you, ma'am, for the today's session. Over to you, ma'am.
Thank you, Ashwini. A very good afternoon, and I welcome everyone for my session. Before my presentation, let us all pray Lord Tanvantari for the well-being of the world, and also I would like to acknowledge the dignitaries for giving me this opportunity. So, coming to my presentation, utility of Kriya Kalpas as a preventive measure in the current scenario of COVID-19 pandemic. Before going to the subject proper, so let us brush on a brief information regarding the coronavirus, though you know about it. Okay, let us know about what is this novel coronavirus. So it was a name given for a severe acute respiratory syndrome coronavirus, that is SARS-CoV-2, which was identified to cause an outbreak of respiratory illness first detected in China in 2019. And the illness caused by this virus was named as COVID-19. Structure of the coronavirus. So when we see the structure of the coronavirus microscopically, how is it? So it has a ultrastructural morphology exhibited by this virus, which has a spikes that adorn the outer surface of the virus. And why this name corona? So the word corona means a circle of light which can be seen, which may be seen around the sun or moon. So the same structure is seen in this virus, hence they have named it as coronavirus. Next, coming to the word pandemic. As you all know that you are aware of epidemic, endemic. So this year, this word was new for us, that is pandemic. So what is this pandemic? Pandemic is the worldwide spread of a new disease, and this spreads all over the world, and most people do not have immunity for this. So hence this COVID-19 is spread all over the world. It has been named as COVID-19 pandemic. Coming to the origin of COVID-19, so it is believed to have a zoonotic origin and has a close genetic similarity to bat coronavirus. So what is this coronavirus? As you all know, it is an infectious disease by the most recently discovered coronavirus, and the most common symptoms of COVID-19 are fever, tiredness, and dry cough. So coming to the incubation period, as you all know, it ranges from 1 to 12.5 days, but it can go up to 14 days also. And the recovery time for the coronavirus disease. So what's the recovery time is that in the mild cases, it may go up to 2 weeks, and in a severe cases, it may reach up to 3 to 6 weeks. So modes of transmission of the COVID-19 virus. The COVID-19 virus is primarily transmitted between people through respiratory droplets as well as contact routes, and it may get transmitted either directly or indirectly. So indirect contact is through a stethoscope or a thermometer, which has been used on the infected person. And in the context of COVID-19, airborne transmission may be possible in specific circumstances in certain procedures or support treatments that generate aerosols, for example, endotracheal intubation and bronchoscopy. And also there are some evidence that COVID-19 infection may lead to intestinal infection and be present in feces, but there have been no reports of fecal oral transmission of the COVID-19 virus till date. Now coming to the subject proper, that is Kriya Kalpas. So Kriya Kalpa is the therapeutic procedure, that is, it can be split into two words, that is Kriya as well as Kalpa. So Kriya means the therapeutic procedure and Kalpa means the special formulations. So these Kriya Kalpas is a local therapeutic procedures adopted in various diseases, especially related to eyes, ear, nose, throat and oral cavity. So any Kriya Kalpa exclusively done to the eyes is termed as Netra Kriya Kalpas. So the subject which deals with this procedure, that is Kriya Kalpa, is Shalakya Tantra. So Shalakya Tantra, as you all know, it is one of the Ashtanga Ayurveda which deals with the diseases and treatment of eyes, ear, nose, throat and oral cavity. So, selecting few Kriya Kalpas that has been explained in Shalakya Tantra, which can be used as a preventive measure for COVID-19, can be classified as Bashpasveda, that is steam inhalation, Jalaneti, nasal lavage or nasal irrigation, Kavala, gargling, Gandusha, holding medicated, liquid in the oral cavity, Nasya, installation of nasal drops, Anjana, application of collyrium, and Netra Prakshalana, that is eye wash. So all these Kriya Kalpas, which is especially explained in the subject Shalakya Tantra, can be used as a preventive measure in the present crisis. So considering the above facts, that what WHO has recommended as a preventive measure, that is to wear masks, self-quarantine, decreased physical interaction and maintaining hygiene, and along with these measures, we can adopt steam inhalation, nasal lavage, gargling, nasal drops, eye wash, etc. to help in keeping ourselves and others safe from COVID-19. Let us come to one of the Kriya Kalpa, that is steam inhalation, that is Bashpasveda. The traditional practice, that is steam inhalation, might be an effective way to care ourselves before medical attention. So here I'm not telling that all these preventive measures will eradicate the disease, will kill the virus. It is acting as a preventive measure which may inactivate the virus or which may decrease the load of the virus or which may increase the immunity of the person before medical attention. So here it is one of the traditional practice which is usually adopted in many conditions like sinusitis, flu and many respiratory disorders. And it might, so this might will be effective against the COVID-19, and also it is effective way for heat application to lungs is by inhalation of steam. And heat application could help to slow down the infection of this coronavirus. The virus infects lungs where it multiplies. So once the virus enters the nasal passage, it takes time to enter the lower respiratory tract. By then, it may multiply in the nasal passage, as well as when it enters the lungs, it multiply rapidly and it may cause disease. So inhalation of steam directly flushes the hot air to the lungs and inactivates the virus by denaturation of the capsid protein and inactivated. So there is the capsid protein over the virus, so that will be denatured if we inhale hot vapor, that is water vapor. So steam contains water vapor heated to about 100 degrees Celsius, as you all know, while the temperature might fall in its journey through the respiratory tract. So there still leaves enough heat that can cause damage to the virus. So here we have to remember that steam inhalation is not a treatment. It is acting as a preventive measure which will damage the virus and it may inactivate the virus. It may decrease the load of the infection. Okay, so this thing we have to understand and it should be used as a preventive measure. Unlike other methods, steaming is harmless and doesn't involve an use of chemicals or any side effects. So as you all know, it is harmless and does not involve any chemicals. So one special note here I have to tell is that, so it is hazardous to the children, okay? So resulting in scars and ultimately lead to hospital admission, surgery, and there may be disfigurement. So one should be very careful with the children. So if a children wants to undergo steam inhalation, attender should be with them. Otherwise, it is not appropriate to give it to the children. And this can be done in many age groups except children. If a children has to go for steam inhalation, attender should be with them. Next is steam inhalation is the direct application of heat into the interior of the lungs and to the area where the infection occurs. It may not wipe out all the viruses, but reduces the load and help to slow down the infection process. So here it reduces the load of infection and it will slow down the infection process if you regularly go for steam inhalation, especially in this crisis where we are exposed or we are going for our work daily, wherein we are exposed daily to the outer world. And this crisis, I think we have to go for steam inhalation daily as a preventive measure when we are back to our place. So it also, there will be extension of incubation period and allows more time for the body to build natural resistance against the pathogen. So by the time it multiplies, the body will start developing natural immunity or the natural resistance against the pathogen. So this is about the steam inhalation. Now let us go to the next kriya, that is nasal irrigation or nasal lavage. So as you all know that Jalaneti is one of the nasal lavage or the nasal irrigation, which is one of the 6 purification procedures or Shat Karmas mentioned in Hatha Yoga Pradipika. So let us understand few karmakata or the mode of action of the virus when it enters the nose. Every virus has a key on the surface, and this one is called the spike protein, and this key opens a lock, and the lock is a receptor, and your nose is just loaded with receptors for this virus. The receptors which is present in the nasal passage, especially in the olfactory area, they are prone for this virus, which is acting as a lock. So this virus has a protein which is a key which unlocks and it gets adapted to that receptor. So if virus impacts there, it finds very fertile ground for infection. It really blooms in the nasal surface. Once this finds the fertile ground that is in the nasal passage, it starts multiplying. So Jalaneti Kriya, if performed, so as you all know that how Jalaneti Kriya is performed by using a special kind of pot called Neti pot containing Sukoshna Jala and a pinch of Samudra Lavana, that is common salt. So understanding in the Ayurvedic terms, the Sukshma Guna of Lavana can be expected to enter Anusrotas, Ushna and Tikshna Guna may be expected to do Kapha Vilayana, thus removing Srota Varodha, facilitating free movement of Vata dosha, and further checks the vitiation of doshas. And Ushna Jala, as you all know, it is Tridosha Shamaka. So by this we can understand it helps in checking the virus. Okay, it is not killing the virus, but it is targeting the virus and it is checking the virus. So undergoing nasal lavage or nasal irrigation daily will help as a prevention for the virus not to get multiplied. In addition to wearing a mask to prevent the virus from getting into the nose in the first place, the UNC research and also the UNC research has suggested that washing virus out of your nose literally at bed night help to prevent from traveling into the lungs overnight. So it has been indicated by UNC research that one has to undergo nasal lavage or irrigation, which we can do in the form of Jalaneti, and it helps in preventing the virus to enter into the lower respiratory tract or into the lungs. And also there is a study where it is said that about 10 to 50 million viruses will be washed out by doing this nasal lavage. Thus, by adopting Jalaneti regularly may help in washing away the virus settled in the nasal passages. which is the fertile ground for infection. As I said before, nasal passage is the fertile ground for the multiplication of the virus, and it is the media where the virus get transmitted into the body. It is the place where the virus enters the body. So if this passage is kept clean, and if we increase the strength of this nasal passage, or if the immunity of this nasal passage is increased, it will decrease the load. Okay, so this is a very important procedure which can be adopted by everyone daily. And also, high volume nasal lavage is safe, and everything in life is risk benefit, and it do not harm. And also, there is a study which is published in the Journal of Medical Virology, says that using nasal rinses and mouth washes, which directly impact the sites of reception and transmission of human coronaviruses, may be able to provide an additional level of protection. So what you, by doing this nasal lavage, it is the additional protection. Okay, so it is not a treatment but an additional level of protection. So one has to go for nasal lavage daily in the form of, by using samudra lavana, a pinch of samudra lavana, as well as the Ushna Jala, and there is a technique for that. One has to be trained before going for Jalaneti. Oneself cannot adopt this Jalaneti at home. So by any trained person, one has to learn the procedure, how it should be done, and one has to do it daily. Next kriya is gargling. So what is gargling? The term gargling is termed as kavala and gandusha. So kavala is gargling and gandusha is holding medicated liquid in the oral cavity. So these are the two procedures which has been explained in Dinacharya, that is daily regimen, and are useful in prevention of diseases of mouth, teeth and gums. So a randomized trial study showed that throat gargling with tap water 3 times a day significantly reduced the incidence of upper respiratory tract infection by 36%. When this was done for 3 times, there was a reduction of infection by 36%. And the possible reasons for the effectiveness of throat gargling may be that the physical washing agent used in the throat gargling causes the shedding of the virus. So by using the medicine in the form of gargling, it may shed the virus as well as the infected cells and causes the chemical inactivation of the virus. So the initial chemical changes that will happen in the nose or in the oral cavity, which are the sites through which the virus enter the body. So if we go for gargling, so we have a chances that these infected cells as well as the viruses will shed off, or it may get inactivated in the oral cavity or in the nasal passage, and it may stop the virus to enter into the body. So how is this gargling done? In saltwater gargling, chloride ions in hypotonic saline have been shown to inhibit virus replication. Very important. A simple salt gargling is enough, wherein it will inhibit the virus replication and are used by cells to produce hypochlorous acid to exert antiviral effects. So though it is very simple, very effective, though it is very simple, using just a salt water, it has an antiviral effect wherein it produces hypochlorous acid, and this hypochlorous acid has an antiviral effects. So this is very beneficial. So this should be adopted daily as a preventive measure in this current crisis. And also the cost of the throat gargling with the tap water or a saline is inexpensive and almost free. So you need not have to pay for it. Just tap water is sufficient with a pinch of what is that, common salt is enough to produce an antiviral effect. And it is social and economic. It has the social and economic benefits of reducing upper respiratory tract infection. Though it cannot eradicate the virus, it can reduce the viral load in the oropharynx. So as I said before, we are not killing the virus or we are not eradicating it. We are just reducing the viral load, which is very beneficial which may not cause the disease. So the virus, if it is the viral load is reduced at that site in the nasal cavity or in the oral cavity, the load of the disease is decreased. Hence, this can be adopted as a preventive measure. Some of the kashayas like Kadira or Kshiri Vrikshas like Negroda, Udumbara may be used daily for Kavala. If gargling done with above said kashaya helps to reduce the virulence of the virus. So by using some of the drugs in the form of kashaya, if it is done daily, which has been told in Dinacharya also, the strength of the virus is reduced. And the throat gargling habits might be suggested for high-risk populations of quarantine people and medical staff. So this is being done also wherein all the quarantine people and medical staffs are adopted for throat gargling regularly. And throat gargling, which is virtually a cost-free modality, might benefit the general population during the current COVID-19 pandemic. And it is all cost-effective, it is free modality, and it will benefit population in large. Next kriya is nasal drops. So before going to the procedure, it is a known fact that virus gets into the nostrils and multiplies prolifically. The nose is clearly the fertile ground for the virus, as told before. The Pratimashanasya. So what is this Pratimashanasya? Pratimashanasya is a type of Nasya karma which is indicated for daily practice and is helpful in prevention of diseases of head, neck, oral cavity, and also respiratory disorders. If Pratimashanasya, so it is nothing but installation of 2 drops of medicated oil into the nostrils will surely keep the virus at bay. So if I take the example of Nasya Thaila, I will take Anu Thaila because it is meeting all the requirements of the ideal Nasya. The Rasayana properties in the Thaila can be expected to improve the immunity and give strength to the nasal passages, which is very, very important. And it checks the vitiation of the dosha. So here the doshas, we can take it as the virus or the pathogen. So it checks the multiplication of the pathogen. Most of the medicated oils are best Virechnika and can be credited to combat the virus. And it is Virechnika, it may kill to some extent, it may inactivate the virus and it may decrease the load or it may denature the protein of the virus. So the Virechnika guna of the Thaila will denature or it may inactivate the virus. Thus instilling 2 drops of medicated oil into the nostril might help to reduce the risk during the current COVID-19 pandemic. And the next kriya is application of collyrium, that is Anjana. So what is Anjana? Anjana is one of the Netra Kriya Kalpa where application of medicine to the internal surface of the lid margin from Kaninika Sandhi to Apanga, that is from medial canthus to the lateral canthus, a medication is applied to the eyes with the help of Shalaka, and this procedure is called as Anjana. So how it is going to help as a preventive measure? So as you all know that Anjana or the collyrium is one of the Netra Kriya Kalpa and it is a popular method of application of medicine inside the eye. This particular procedure is mentioned as a daily routine in order to protect the eye. So it has been told in Dinacharya. Why it has been told in our daily regime? To protect the eye from many hazards like which is caused to the eye due to daily exposure. It may be dust, smoke, foreign bodies, many things. Okay. So also to maintain respiratory health. How is this related to the respiratory health? So the anatomical relation between the eyes and the nose is NLD. So what is this? NLD is nothing but the tear ducts or the nasolacrimal duct. So this nasolacrimal duct starts from the eyes at the end, at the medial canthi of the eye, and it opens into the inferior meatus in the nose. Okay, so this duct may carry the virus from the eyes to the nose and from to the nose to the respiratory system. So we have to keep our eyes we have to increase the immunity of the eyes and protect from pathogens. So one way of protecting the eyes, application of Anjana, which keeps the eyes lubricated and protects it from environmental chemicals and pathogens. So traditionally, Sauviranjana is indicated for daily application. So application of Sauviranjana to the eyes expel the impurities from the eyes. If at all, if we are exposed wherein the pathogen has entered our eyes, so if we daily apply Sauviranjana, the eyes would get more immunity or the strength, and the medicine has got a strength, or it has got a power to expel the impurities from the eyes. So Saviranjana is the best Anjana that is indicated as in a daily regime. By considering the above facts, application of Anjana, that is medicated collyrium, may act as a preventive measure in combating the virus. Again, here it is not killing the virus, it is combating the virus, where it may inactivate the virus or it may denature the virus if the pathogen is present in the eyes, and it is acting, this Kriya is acting as a preventive measure. So Anjana has been used in medicines for many years, and there is no negative effect on health and can be applied in the situation of this crisis, that is pandemic COVID-19. And coming to the next Kriya is eye wash. So we can consider it as Netra Prakshalana. To stop the spread of the deadly virus, eye care during coronavirus pandemic is very, very important. And the first thing to understand is that coronavirus can spread through the eyes just as it does through the mouth or nose. It is not just the mouth or the nose acting as the passage or the entry of the virus into the body. Even eyes are the side through which the virus may enter into the body. So one has to be very careful in protecting the eyes, mouth and nose by adopting a few kriyas. For protecting the mouth, go for Kavalagandusha. For the nose, go for nasal lavage as well as Nasya. And for eyes, Anjana is very much applicable. People who have been infected by coronavirus can also spread the disease through the tears. So one has to remember that a person who is infected by the virus, even his tears has a virus in it. And if the person touching the tears of the infected person may land up in the infection. So one should be very careful about this. So to keep yourself protected from virus, a basic eye care should be adopted. So what is it? Do not rub your eyes. So do not rub your eyes. As you all know, the sanitizing is very important. If you have not sanitized and if it is unhygienic, if you start rubbing the eyes, the pathogen may enter into the eyes. Again, you are infected. So don't rub your eyes. So if you feel any irritation or itching, it is better to sprinkle water to the eyes. Avoid wearing contact lenses. Again, contact lenses. The people who wears contact lenses have a tendency to rub their eyes. So it is better not to wear contact lenses in this crisis. It is not in normal days or in regular days or in general. In this crisis, people who wear contact lenses shouldn't do it. So what is the method how we can wash our eyes? That is Netra Prakshalana. So eye wash with medicated decoction of Triphala as well as splashing tap water may help in flushing out the pathogens, or it may contribute to the reduction of the viral activity. So just Triphala Kashaya, a mild Triphala Kashaya is sufficient, wherein you have to go for washing with this Triphala Kashaya, and it helps in flushing out the pathogens. Or just a tap water splashing once you come from outside to your place and splash with a cold tap water, or if a decoction is ready, you can go for washing your eyes with the Triphala Kashaya. So this will somehow will reduce the activity, viral activity. And lastly, sunglasses or prescription glasses can be worn while going out to protect our eyes in the present crisis. So it is better to wear sunglasses or prescribed glasses so that it will be avoided where the pathogens are avoided entering our eyes. So better we use sunglasses and the prescription glasses when we go outside. Next, coming to the conclusion part. So these are the few kriyas wherein these kriyas is not a treatment, it is the preventive measure. So as WHO has recommended, go for wearing mask and hand sanitization, social distancing. So all these are recommended by the WHO as a preventive measure. So we as a Ayurvedic doctors, we have certain kriyas which has been told in our classics. If adopted or if done daily in our daily regime, so it is surely help in preventing the viruses entering our body. Either it may decrease the load of the infection, or it may inactivate the virus, or it may denature the protein which is present in the virus, or it will help in increasing our immunity power also. So this is very, very important. So these these kriya kalpas, if done daily, surely will help the people who are prone, or we are exposing to this COVID virus, and this will be extended for few months or few years. So I request, or I suggest that people should go for adopting all this kriya kalpas in their daily routine. So people all over the world are facing this crisis with ill effects and continue still date. So most people, that is about 80%, recover from the disease without needing special treatment. And for the majority, especially for children and young adults, illness due to COVID-19 is generally minor. However, for some people, it can cause serious illness. Although for most people, COVID-19 causes only mild illness, it can make some people very ill. More rarely, the disease can be fatal. Older people and those with pre-existing medical conditions such as high blood pressure, heart problems, or diabetes appear to be more vulnerable. So considering the above facts, and as per the saying, prevention is better than cure, which is the main motto of Ayurveda, one has to stand by it to prevent the infection. In this massive spread of the virus, it has become critical to wear mask, which reduces coronavirus transmission up to 80%. And it is a known fact that the transmission of the virus is reduced up to 80% if one wears mask, and we are doing it and we are following it. We are following the recommendation of WHO. And also self-quarantine, decreased physical interaction, and maintaining hygiene is our only choice. And along with that, we are going for self-quarantine if we expect or we suspect that we are exposed to the virus, and we are also not going for physical interactions, and we are maintaining the hygiene. So this has become a choice of the day, of the year, of the month, and of the day. So along with these measures, people has to understand the significance of steam inhalation, gargling, eye wash, nasal lavage. So these are the few kriyas if we adopt, and this help in averting the virus, and this may aid in avoiding transmission of the pathogen. So along with these preventive measures like wearing mask, quarantine, decreased physical interaction, and maintaining hygiene, one has to think about a few kriyas like steam inhalation, gargling, eye wash, nasal lavage, etc. This will avert the virus and will avoid the transmission of the pathogen. And coming lastly, seek medical attention immediately if you have any symptoms, and keep up to date on the latest information from the trusted sources such as local and national health authorities. One should adopt the above said kriyas daily, irrespective of the current crisis in future. So this is not the explanation only for this present crisis. So one has to adopt these kriyas daily in future also when this pandemic vanishes. The pandemics in future can be defeated with science, solutions, and solidarity. So this pandemic can be defeated. So this is said by WHO, where they have said that this can be defeated with science, solutions, and solidarity. As said by WHO, that the world must prepare for the next pandemic now. Let us all not be reluctant, and let us lead a very disciplined life. So by finishing this, I would like to thank everyone for attending my session. Thank you.
Thank you, ma'am. Thank you. The presentation was very informative for sharing your views regarding utility of Kriya Kalpa in COVID-19 pandemic. So thank you. Stay tuned to Tattva Prabodhini 10th scientific session tomorrow morning at 11 a.m. onwards. So thank you, one and all.